Hello everyone, I'm Dr. Pragati and I want to share one of my experience from yesterday. I went to take interview of sickle cell HBSS pattern patients yesterday, and because of my thesis, which is quality of life in adult sickle cell patients. So please let me know if you have anyone who has HBSS pattern of sickle cell who is adult for my thesis. That will be very helpful. So what I want to tell you that when I interviewed them for with the questionnaires and then physical health, mental health and social health with my questionnaires, so what I was able to note is that there were two patients. Both were around, one was 23-year-old and other was around 25-year-old, and the 25-year-old said to me that he has to come to hospital every month and to be admitted there for almost 2 to 3 days every month because of the pain. There is severe pain they experience, abdomen pain, chest pain, joints pain. There is swelling or feet. They cannot walk. They have so many complications like acute chest syndrome they develop, or avascular necrosis. So this my 25-year-old patient also developed avascular necrosis, and because of it he has a difficulty in sitting, walking, everything. He has difficulty in everything. Even he has his livelihood is inserting tiles to the ground and tiling and construction work. So he has difficulty in carrying out that work, which is what I want to say here is that what I thought sickle cell was, and maybe so many people think that it is a genetic disease and people develop this genetic disease and they require blood transfusion because their hemoglobin level decreases and stuff. That I used to think. But when I and over we usually see HBAS pattern, which is not that severe pattern. So we usually see this pattern, AS pattern, and we decide on those AS cases that okay, these people are normal. But when you actually see HBSS, which is very rare, when you actually see SBSS, then you come to know how the reality is and how these people are. This is not only genetic disease, this is a very worst quality of life they are living in and they are born with. Like, not only on their physical health it is taking toll, that they have to be dependent on their family, their friends to carry out the basic tasks like walking. My patient, I asked him, will you be able to walk for 1 kilometer? And he said to me, no ma'am, I cannot walk for 1 kilometer. So then I asked him, how much can you walk? So he said me that he can only walk from casualty to main gate of the hospital, which was only 200 to 300 meter. So can you imagine a boy in prime, that is 25-year-old, can only walk up to 200 to 300 kilometer, then he'll start developing pain or need assistance for walking. So that is a very worse quality of life, I feel. And then I not only physically, but when you also speak to them, do you feel that this quality of this disease is stopping you from achieving things you have dreamt of, or you are feeling burdened because of this disease, or you are feeling that your health is not like everyone else, and why do you have it? And no, and then then I asked him that you fear of death, or you fear constant overthinking that one day I am going to die soon. So what these people experience is not only physical burden or physical trauma, there is also mental health issues they are likely to develop because of this overthinking about the health and all the anxiety, and they can go in severe depression because of this. And along with this physical health and mental health both becoming worse, the patient is very likely to give up on his life. So I talked with both of them, and I asked them to go through morning motivation every day, that when you get up every day, just be grateful and start your day with high energy. And even if it is not possible to accomplish all the tasks you have thought you will be accomplishing in this day, it's okay, but start your day with thinking that okay, I'm going to do something new, or I am going to do this thing, that thing. डोंट बी लाइक कि नहीं यार, नहीं हो रहा है, नहीं हो रहा है तो मैं क्यों करूँ, मैं सो के रहता हूँ और सब लोगों के लिए मैं बर्डन हूँ. डोंट बी लाइक दैट एंड गो इन टू कॉन्स्टेंट depressing states. So what I want to say is that what we think all these genetic diseases are is not actually what the patient is experiencing or what actually it is. Even my senior sir said that it is very traumatizing to have this sickle cell or thalassemia major diseases. It require constant blood transfusion, hospital admissions. There is lot of pain patients are experiencing along with the mental traumas. So that's I want to all of you to make aware about. And please let me know if someone has HBSS pattern of HBSS pattern sickle cell, so I can also help them in some way. Thank you.